Talk Show.
Recorded live.
Hey, everybody, what's going on? I'm really excited. Beautiful day here in Staten Island, New York. I'm telling you, we move forward with great Lyme awareness shows here on WIRN, Internet Radio. Oh, yeah, yours truly, Joey Giggles, Joseph Aquilino, my real name, is happy to be doing these Lyme awareness shows, and we have 3 more days after this of Lyme awareness. So really exciting as we move forward, because I think it's very important to get the word out, about these conditions, especially autoimmune and chronic pain conditions, and this being one of them, Lyme. We also have many other awareness months this month that we focused on. We focused on lupus last week. We had a show on lupus last week. We had three days of shows on lupus last week. And these 2 weeks are basically designated for Lyme awareness. I am really excited to announce that WIRN will have continuing education on Lyme's disease after Lyme awareness. Oh, yeah, after Lyme Awareness Month, something called Lyme Time that we're going to have here on WIRN Internet Radio. It's going to be a show here that we have with some of our notable people that, know about Lyme disease. And it's going to be a really good show. It is going to be called Lyme Time, and it will be here on WIRN Internet Radio. You can come here for all your knowledge on Lyme. And it would be great to have some of these great folks, like I said, these advocates, these leaders, to come on here and talk about Lyme. I learned about Lyme myself, because I do have RSD-CRPS, another autoimmune disease that people, want to know about. So, I have a show on that, and I want to have a show on this too. God bless. All right, so we're going to move on with our next guest here. And the next guest is Sherri Connell, and she's coming on to talk about her Lyme experience, ladies and gentlemen. Here we go. Hello, Sherri.
Hey, Joey.
How are you?
Hi, Joey. Thanks for having me on. Good. How are you?
I'm doing well. Thank you so much for coming on. I appreciate it. Yeah.
Thank you
All right.
for doing so much awareness for Lyme disease.
I'm trying my best.
You are.
That's what JGF organization and WIRN combined is all about. We want to get the public to understand these autoimmune diseases, all autoimmune diseases and chronic pain conditions, because like I was talking to the doctor before, not many doctors know about these, conditions. And unfortunately, when we go to doctors, they're not inclined to treat us correctly because they don't know, about these conditions. So the first series of questions to the doctor was how to get doctors more involved in learning about chronic pain and autoimmune diseases. Mm-hmm. So that was the first question. So, all right, Sherri, we're going to talk about your experience right now. So why don't you start from the beginning of your Lyme experience and tell us where you are today.
Well, you betcha. I was born into this world a pretty healthy kid, but I had my share of issues with pneumonia and different things as a child, but I was very active, very happy, and I actually got my first job at 10 years old. I was a workaholic. I love working. And I worked taking care of horses when I was 10, and then I worked at a pet store, and then by the time I was 14, I worked at a clothing store. And when I was 14, I went to visit my grandparents in Arkansas, and they had all over the news that cows and horses were falling over dying, and they didn't understand why. They knew, unfortunately, I'm old. This was way back in 1977. So if you can imagine, maybe some of the listeners weren't even born then. But they didn't know what Lyme disease was then. All they knew was to tell everyone to not go outdoors, and if you do, be sure to wear your socks outside your pants, tuck your pants in, wear long sleeves, don't hang out there because the ticks are biting the horses and the cows and they're dying, but we don't know why.
Mm-hmm.
Well, we were there visiting and we were children. Are we going to listen? Well, we wore long sleeves and long pants, but my brother and I went fishing several days in a row out in a pond, and I sat in the grass. I didn't like fishing, but I wanted to go and be part of my big brother's experience, and I sat in the tall grass for hours at a time for several days. And when we got back from the trip, I had suddenly gotten a rash from head to toe. I did not get the bullseye rash that is common but not always necessary to show that you have Lyme. But I had the rash from head to toe, and nobody could figure out why. And then I was having chronic headaches, chronic infections all through high school and college. And a couple people from high school called me I was nicknamed the physical disaster area. Just such a fun thing to be called when you're in high school. Of course, my teachers thought I was just trying to get out of schoolwork. But despite all that, again, workaholic. I was a cheerleader. I worked a full-time job all through high school, put myself through college. By 19, I was having paralysis. I was singing and dancing in musicals, and all of a sudden my legs would go paralyzed, and I didn't know why. I was doing a lot of, having a lot of infections, flu, strep throat, bronchitis, pneumonia. Nobody knew why.
Mm-hmm.
By the time I was 27, I became paralyzed from the ribs down, and I couldn't sit up. I could barely talk. I couldn't shower myself. I couldn't make a meal. I was rushed to the hospital, and I was in the hospital for a week, and they diagnosed me with multiple sclerosis. They gave me IV Solumedrol, which is steroids, and they told me I was going to be in a wheelchair the rest of my life. I didn't listen to them. I said, so what? I'm in a wheelchair. I can still work. I can still sing. I can still act. I can still do all these wonderful things. My boss was going to give me a wheelchair-accessible desk. It really didn't look so bleak to me at the time. But unfortunately, that being unable to sit up, care for myself, my own daily needs, shower, and get my own meals, clean, all those things that you need to do to live, I could no longer do. And wow, that was 24 years ago. And ever since then, that's all I've done. I've done alternative medicine. I've tried all the antibiotics. I've done countless numbers of things, and I'm still fighting. And but unfortunately, by the time they caught it, when I was 27, my immune system was trashed by all the steroids, and it took over all my organs, my brain, my spinal cord, and everything. So it's just been a battle since then.
Wow. Yeah, it sounds like it was. You're not that old. I was born in 76, so, it doesn't, you're not that old. I mean, so, I mean, I lived through the 70s myself, the end portion of the 70s, and, I was a little kid, then I really didn't comprehend any information per se, so I didn't really know about, the cows and the stuff like that. I didn't know about that until you actually just said it. But really interesting, how this bug, the Lyme disease, really gets into not only humans but animals, and actually, kills the animals too. I mean, it's more or less that, if it's not a tick, it's a mosquito or a biting, bug. Then we found out, on the last show that we had, that it's hereditary. It could be hereditary. It could come through mother's milk, and various things like that, from strains, of Lyme. So did you find out what strain of Lyme that you have?
Well, I don't have all that technical information in front of me right now, but all I know is in that location and where I got it, it obviously was a pretty hardy strain if it was going to kill the cows and the horses, because right now, I mean, animals do get it, and fortunately and unfortunately, a lot of veterinarians know more about Lyme disease than our medical doctors do, but in general, and animals are, in general, more likely to get treatment right away, which is great. And but I'm not seeing the animals like falling over dead with Lyme disease these days. Hopefully, they have a chance to get on some treatment and get better.
Yeah.
And it sounds like to me like the veterinarians are really doing a good job with that.
Yeah. So, in your case, what were the treatments that gave you the most success? I mean, did you find success in conventional treatments or holistic treatments or herbal treatments? Where did you find your success?
Well, I'd love to report that to you, but unfortunately, all I can say is when I was a teenager, when I did take antibiotics, when I was on antibiotics for bronchitis and other infections, I did feel a lot better, but I didn't know I had Lyme disease then. Mm-hmm. But by the time I got antibiotics, the large doses that's really necessary, I had already had it for 16 years. And I went on IV antibiotics for almost 5 years, and I was on oral and intermuscular antibiotics as well. And I did not get any relief at all. And so at this point, I can't take antibiotics anymore because I have taken so many. So I have done a lot of other alternative medicine, different types of IVs. I've had ultraviolet blood irradiation. I've done the salt C. I've done all the herbs. I've done all the vitamins. My family calls me Dr. Sheri because I have studied nutrition in so much depth to try to save my own life that I can answer a few little questions with them here and there, but I don't want to sound negative because I have seen some incredible doctors, and in those journeys I have met, I can't even tell you how many patients I have met that were really sick with Lyme disease who found help through all these different therapies, but unfortunately I just have not. Wow.
So I mean, like you're just basically, you're just living with it then. You're just being positive and living with it, basically.
Well,
right?
That's what I'm doing. I'm trying to look at every day as an opportunity to count my blessings, even how small they can be. Wish they can be really small, and just try to be thankful for everything. But it is hard for anybody, but especially for somebody who is a workaholic. I have 3 college degrees, and I was starting my master's when all this happened. I lost my house, I lost my career, I lost my horse, I lost my ability to sing and dance in musicals. I don't ever, I only talk on the phone, maybe to my mom. Just talking on the phone is excruciating. Yeah. Hanging out with people is excruciating. So, paying just to talk and to sit up and try to be me. But that's basically my mission right now is to, number one, I'm still trying to get better. I am searching. I am, a lot of times because I am online, I'm on Facebook, and my husband is a founder of a nonprofit organization. We get phone calls and emails and people saying, your wife just needs to take antibiotics and then she'll be better. People don't have any idea how difficult that is for someone with late chronic Lyme disease. And they don't understand the difference between an early case and a later case. And it's not always time. I've met a lot of people that were late chronic, it did real well. I'm not a doctor, but I think it just has a lot to do with how the immune system has adjusted to it. And right now, my immune system is better than it ever has been.
Okay.
But it's kind of like having your soldiers, and they're all buffed up, and their muscles are real good, and they're in their uniforms, and they're ready to go out and battle, but they don't know who they're battling.
Right.
So, my immune system is all buffed up and doing great, but it no longer understands that the spirochetes are the enemy.
Mm-hmm.
So no matter what I take, it doesn't really matter because I can boost my immune system, but I can't tell it what to do.
I hear you. I hear you on that. So are you still in a wheelchair now, or could you get up and walk?
Well, when I was hospitalized, after I was hospitalized and let out of the hospital, I went through a year and a half of physical therapy, and I was able to start walking again, which has been amazing.
That's great.
Yes, and I'm kind of, you see those stories about people who have injuries or different things happen to them, and they're walking on the bars and they're learning how to walk again, and that was me. And
okay. Mm-hmm.
It was so exciting because it was a whole new appreciation for having that, but I still can't walk very far and I can't stand very long, and it's, the severe cognitive problems and the pain and those kinds of things that keep you more down than the wheelchair. And the chair, being in a chair is very difficult, and it was a challenge. But I still could have worked despite the chair. I still could have done things that were important to me despite the chair. So that's why my husband, I don't know if you want to discuss this, but my husband founded the Invisible Disabilities Association because people don't understand what they can't see.
That's right. That's right. And it's awesome. I'm actually a part of that. I didn't know he was the founder of that, but I found you guys' website, and I'm in it. I'm actually a member. So yeah, that's great to know. Actually, yeah.
Fantastic.
So we've got some questions here from our listeners, and we got some questions here from Jennifer, and they want to know, do you have any other family members that are afflicted with Lyme?
I do believe that my brother did get it. He had a lot of chronic pain and fatigue issues after our wonderful visit to my grandparents' house, but he never searched and actually tested to find out, and unfortunately my brother passed away a few years ago, and that's been real hard on the family, but I do suspect he probably had it as well.
Oh, wow. Okay. All right. Sorry.
But I don't have children, so I'm not sure if that's where maybe I know I did not get it from my parents. I know I got it from the visit, but I don't have children, so I know that I'm not passing it along, and that's not why I don't have children, it's because I can't care for a child, but I have heard that can happen.
Gotcha. They want to know also, are you working now?
I am unable to even care for my daily needs. Just for me to make this phone call is a huge endeavor for me, but I have to spend an hour in bed when I wake up doing brain exercises just to be able to get up, and then I have to do an hour of physical therapy just to be able to stand up and move, and then I have a green drink and all my supplements in the morning, and then it's 1 o'clock in the afternoon. And I have doctor's appointments, I have phone calls and, insurance claims, and that's my job, is staying alive right now.
Well, that's good. That's good, because my job is doing the same thing. So there you go.
Yeah.
And my job is also doing this radio show. So
I know. And people do ask me that quite often, and it breaks my heart because I am a workaholic, and I did have huge goals and plans for my life for working, and I'm fighting every day to get better and appreciate. I would appreciate anything at this point. If I could just cook or clean or take care of myself, I'd be happy. But then I know that I'd only be so happy, and I'd want more.
Of course. But it takes time. All this stuff takes time. So,
I know.
Take it step by step, and you'll get there. You'll get there and start doing things again, So think positive. Definitely think positive. So my next and last question to you is, what are you doing for Lyme Awareness Month?
Wow. Oh, so what am I doing for Lyme Awareness Month? I am having a blast with bit strips. Do you know what bit strips are?
Oh, yes, bit strips. Yes,
I
see you posted a few of them on the event. Yes.
You betcha.
Yeah.
Basically what they are is when they're little cartoons that you can make, and so I've been making a few of these online for Lyme awareness, and each one of them has information to a video interview I did with the Huffington Post. They have a video show. Well, it's basically a news show online that's called HuffPost Live, and it's called A Tick Bite Changed My Life Forever. Mm-hmm. And I'm telling you, it was amazing because this piece that they did had like 20,000 views in one day, and it went crazy. And if you Google it or whatever, Bing it, it's really getting a lot of really good awareness for people with Lyme disease, and not just people with Lyme disease, but anybody who is debilitated by some sort of illness or condition.
Mm-hmm.
So we have that. I've got my bit strips, got my blog, which is SherriConnell.com, and I have information on there about Lyme disease and a couple of other illnesses that I live with.
Yeah. Mm-hmm.
Mhm. And so, of course, that all goes out on Twitter and such.
Oh yeah. So just tweet those to me, and I'll retweet them out to everybody out there. Retweet those links to me, and I'll definitely retweet them all out there for you. I'll post it on my Facebook wall so everybody can see it. And it's great. It's great, that you're doing a lot for Lyme Awareness Month, and just by doing what you're doing is and being here, you're being a face and a voice for Lyme, and that's great. I think that's awesome, I think that's very important. The more unique experiences we can get on the air here, the better it will be, going, forward, because, again, everybody has their own unique experience, and by hearing each unique experience, you learn something new, and we heard Sherri's here, and we're going to be hearing Angie's coming up very shortly in another 5 minutes, so.
Fantastic.
Yeah, so it's great. It's really awesome. I am really excited that I got a chance, to do these shows, and it was my choice, obviously, through JGF organization, the organization that I created, to do these awareness shows, and WIRN, the radio station that I created right here, so we could get the word out. I think it's important, ladies and gentlemen, that, the more awareness, the better. The more awareness, the better. And God bless you there, Sheri.
Well, thank you. And I hope that people can, people with Lyme disease out there are listening to my story, don't get depressed as a result of my experience. I mean, right now there's a lot of really good treatments out there, and not just antibiotics. There's a lot of good alternative medicine that's working for people in the earlier stages or whose immune system is working a little bit better. And I'm seeing a lot of people around me getting some better results, and just every day, just for your immune system, for yourself, just try to count your blessings. And I know that coming from friends and family can be quite annoying, but this is coming from someone who's living it too. We have to somehow learn to look for positive, even though it's really hard. and connect with people who understand what you're going through, and don't give up. And I hope you join me at the InvisibleDisabilitiesCommunity.org as well, because we've got some great support for anybody who's living with all kinds of illness, any kind.
Oh, yeah, definitely. Like I said, I'm a member, and I hope a lot of you become members because there's a lot of great information there. And it's great to know that your husband started it now. So that's awesome. That's great. And we'd love to have him on the radio show to talk about that. That would be awesome. And, maybe we could do a show maybe with him, to talk about the invisible disabilities community. That would be great, and then he could give what's the link to that so everybody knows the link to that.
Well, just to the community. The community is InvisibleDisabilities.org. InvisibleDisabilities.org is the entire Invisible Disabilities Association, which offers education, awareness, resources, and support. There's all kinds of videos on there that people can share, blogs, pamphlets, to help your friends and family better understand what you're going through. And then the community, where a patient will talk with another patient and get tips with each other and learn and have new friends, have people you can vent with, because your friends and family don't want to hear it all the time. But it's not all negative. We have lots of encouragement. That's InvisibleDisabilitiesCommunity.org.
Okay. Oh, so you got two links then. Oh,
well,
okay. That's
it's basically Invisible Disabilities Association is the big association, and within there they have the community.
Okay, that's awesome.
You can find it all on InvisibleDisabilities.org.
So you think your husband would want to come on and chat about that?
Oh, he's always wanting to talk about it. Absolutely.
So maybe we could set something up with you guys in regards to that, and we could get him on another show.
That's a possibility. He does work a full-time job, and he runs the organization evenings, weekends, and holidays. So he is super-duper busy, but if we can fit him in, that'd be wonderful.
That's awesome. Thank you so much for being here. Our next guest is here. Yeah, if you'd like to stay there, Sheri, you're more than welcome to stay and listen to the next guest. I will extend the invitation to you, and thank you so much for being here.
Okay. Thank you so much. Have a great week.
All right, you too. Take care.
Bye-bye.
Bye.